Okay, we're now broadcasting. Good morning for those people who are on right now. We are going to start in just a couple of minutes. We have about 100 people registered for this webinar, and people are coming in. We have about 60 participants on board right now. So we will wait a couple of minutes and for more people to come in, and then we will start. So we're going to start in about a minute, and I'm sure people will be coming in as we move along in the presentation. So I think we should get this going. It is 10:02. Unless my fellow speakers feel differently, should I have a thumbs up or a thumbs down? Okay. So welcome everyone. I am Jan Fisher. I am the Executive Director of Nonprofit Westchester. And we are here today to discuss the nuts and bolts of returning to the workplace. And I first want to thank Suzanne Gardos, who is our Manager of Community Engagement, for helping to get this all organized in the time of Zoom and virtual meetings. It really is so helpful to have somebody who can launch this all for us. So we're coming together today with some really great subject matter experts in this area and partners to Nonprofit Westchester who have been really, really helpful to us. I do have to give a special shout out to Chuck Newman, who both before the pandemic and during this pandemic has been a tremendous source of just consultation and expertise, and a really good friend to me and the nonprofit sector, and has helped me bring together this great group of speakers. So today we have with us Marc Roberts from my HR department. I got to see his presentation last week and was so taken with it that I emailed him right after and asked him if he could join us today. So we're happy to have Marc with us.
Thank you, Jan.
And Brian Auerbach from Paycor has come in as one of our newer business members and has also been a great source of support. And Paycor has some pretty awesome materials out there that are easy to use and easy to understand. So we're always thankful for that because everything is so complicated today. Chuck Newman, who I introduced.
Morning, everyone. Thanks.
And Ilana Arbeit from Charles Newman Company, you know, also just both of you incredible partners to us. So next slide, please. So we, you know, again, here we are. These are our sponsors for today's event, and we are really proud to welcome our newest sponsor, which is C-Clean, and they are sponsoring this 4-part series for us, and some of their information is you will see later, but they have been a great partner as well. And Joe Pizzamente, the owner, has also been a really good partner and sponsor to NPW. So today, as you see up on the screen, we are going to be, I will briefly be going through the governor's New York Forward Plan. We will be talking about office safety planning, policies, procedures, practices, communication, and insurance. So next slide, please. So we are really always thankful to our sponsors. You make our work happen, as do our members. So we are really thankful to our members, to our sponsors, and to our board of directors and our overall membership. You all have been just incredible during this time. So thank you again. Next slide, please. So just want to remind everybody of the mission of nonprofit Westchester to strengthen the visibility, capacity, and impact of the nonprofit sector in Westchester for a more just and caring community. We know now more than ever our mission and what we're doing is critical. So we thank all of you and those partners that are helping us on the way. Next slide. The ever important disclaimer, things are changing by the minute, it seems, and what is good guidance one day is not as good the next day, it seems. So at the time of this presentation, this is the best information we have, and we always recommend that this is an overview and that it really is important for everyone to dig a little deeper, especially now in terms of reopening and safety. So we will provide you with as good of an overview as we can. We think it's a great overview, and let's move forward. Next slide, please. So the governor's New York Forward Plan, that's what I will be addressing. Next, please. So you know what, I am just having a little trouble seeing my own PowerPoint because everybody is on the side. I think what I need to do is move you guys over. Okay, perfect. So sorry, everyone. So as we know, the governor has put together a really extensive reopening plan and has a number of metrics for reopening, which are based on expertise from the CDC, the World Health Organization, Department of State, and other experts. Reopening does not refer to those businesses that are already open, although they too are going to have to follow certain guidelines. But the reopening refers to non-essential businesses, and this information is available in a book put out by the governor's office, New York Forward book. And we will be sending this PowerPoint to everybody who's participating with links to all the materials that we will be mentioning and even more materials. So next slide, please. Great. One before that, please. So as probably most of you know by now, there are 7 metrics for reopening by region. We are in Westchester, are part of the Mid-Hudson region, and we are not there yet, but we are almost there. So the 7 metrics really fall into 3 categories. One is about the ability to monitor new infections and to make sure that that is on the decline. And I'm not going to go through every metric because you can see that as well. The other is the capacity to deal with the illness itself. Do we have enough hospital beds and ICU beds? So those are metrics under healthcare. And then this is where I think we're still not quite there yet in Westchester. I don't know about the rest of the region, which is diagnostic testing and contract tracing capacity. we have to be able to keep track of the illness. And so those are the sets of metrics. And again, you can always call me or go onto the state's website for further information about this. It's amazingly comprehensive. Next slide, please. So here, as of yesterday, when late last night, when I put this slide in, this is where we are at in terms of our region, Mid-Hudson. I thought we were, okay, this is not the most recent because I do believe we're at 5 out of 7 metrics at this point, but I will update this slide and let you know at that point. But this is a general idea of how the state is keeping track of how and when we can open up using the metrics given. Okay, next slide, please. There's phased reopening of businesses, and I'm sure you all have heard this, but you need to have 2 weeks between each phase to make sure that coronavirus hasn't started spiking up again. And, you know, also the ability over that 2-week period to follow where the virus is and make sure it's decreasing. The way the governor and his team decided on what businesses go first are based on those with greater economic impact and inherently low risk of infection. Very important that, you know, businesses must not open up to large groups of people outside of the area. We did just find out yesterday that you can hold religious services, but not of more than 10 people. That came yesterday. That was another question that was asked of us. So next slide, please. And if you all have questions, you can put them in the Q&A, and we will be taking questions at the end of this, at the end of the webinar. So as you see, here are the 4 phases for opening, and a number of regions have begun phase 1. Nobody is at phase 2, phase 3, or phase 4 yet. And again, we provide a tool, the New York Forward Business Reopen Lookup tool that is available for anyone on the New York State website. So we are hoping to be at phase 1 in a couple of weeks, but things are constantly changing. So don't hold me to that. Okay, next slide, please. And then once businesses do reopen, there will be ongoing monitoring. And the goal of the ongoing monitoring is to make sure that the pandemic does not come back. So there are a number of guidelines and systems in place. Each region will have a control room. Those control rooms will be monitored by a team of elected officials, hospital and state representatives, and they will look at the key indicators and the metrics so that we can stay open. The more that we follow the guidelines and are compliant with the guidelines, the less likely it will be that we will have to close. The monitoring will be so comprehensive that businesses will be shut, and we will be shut as a region if we don't follow the rules. Okay, next slide, please. So as I said, we will have these regional control rooms. These are the things that we'll be monitoring, and the state will be providing really comprehensive oversight. And okay, next slide. Okay, so enough of me. You know, again, we will, in our resources at the end of this presentation, we will have a lot of links and other things that you can go to dive a little deeper. So I'm really happy to hand this over to Marc Roberts, who is the Managing Director of my HR department. There's so much information here, and Marc does a really good job of providing a comprehensive overview. Restart, rebound, rebuild. Thank you, Marc. I'm happy to welcome you.
Thank you, Jan. Good morning, everyone, and thanks for joining us. Next slide, please. So having watched for the last few weeks Governor Cuomo's daily press briefings, it really hit me that this is a unique opportunity. You know, the old every cloud has a silver lining, and while we're under a very dark cloud, the silver lining is most businesses that are not currently operating at full capacity really have an opportunity to start with a clean slate. What do I mean by that? If you have policies and procedures that you've had ongoing that haven't worked for you, maybe now's a good time to revisit them. If you've had position descriptions that didn't adequately define the role that you thought should be going on with the appropriate individual, look at your position descriptions, redo them. Vendor relationships. Now's a great time to look at your vendor relationships, because as businesses come back, people are going to be very hungry to get business, and you may be able to strike some improved deals better than what you have right now. And again, just look at your customers, your vendors, any constituency that you're doing business with, and see if you might be able to improve those relationships based on a restart basis. Next slide, please. So as employers, what should you be doing now? And this is kind of a higher level look, but you should be looking at your remote work policy. If you've been fortunate enough to continue your business using a remote workforce, now's a good time to start thinking about what has worked, what has not worked, and make sure you make it very clear with the employees that may be brought back to an office environment or a factory floor, whatever the case may be, that some of the privileges or practices that they may have had working remotely from home were just that. They were a one-time deal, and you know, that we don't operate this way ongoing. However, if you are going to be like many companies that are continuing to work remotely, you need to redefine those policies and make sure that you're thinking about it outside of a pandemic response, but an ongoing business strategy. Great example is, I think it's Google or one of the large companies. Most of their employees who are working from home wanted to expense the snacks that they were having, which were ordinarily free when working at the office. That's a bone of contention. Employee handbooks. There's probably, at this point, I could probably list off about 10 to 12 items in your employee handbook that will need to change, from PTO policies, remote work policies, exceptions for high-risk individuals. All of your handbooks, if you haven't had one done yet, now's a great time. But if you do have one, it definitely needs to be updated going forward. Great time to also think about a business continuity plan. While this is a unique situation that shut down your business, what if there were a fire in your building or a hazmat situation in the street adjacent to your building that you couldn't get in there? You really need to map out how your business continuity should look, from telephone lists to who's going to do what, how do you contact vendors and suppliers. It's a very methodical plan that would become a desktop reference to all of your key managers, such that if an emergency were to come up again, you would have a plan in place. Cybersecurity, another big issue. You've spent all that money to have your workplace on a secure system, and now you've sent everybody home working on tablets, laptops, desktops that don't have nearly the same security levels that you have in your office environment. And now they've exposed your office environment to all of the nasty, dangerous people out there that would want to get in and cause havoc in your system. Leverage your downtime. Great opportunity to do web-based training. You have some statutory training requirements, such as the annual sexual harassment training or other trainings. Just do them now. That way they don't interrupt the ongoing business. We talked about job descriptions. We talked about system efficiency, and start thinking of a plan for getting back to business. Next slide, please. First and foremost, you must work on your workplace safety. You are obligated as an employer to provide a safe work environment for your employees. If you're a small employer, it's a moral and good business practice responsibility. If you're a larger employer, there are government regulations that get into workplace safety. 4 letters, OSHA. You need to come up with an employee health screening procedure. When you reopen your business, how are you going to bring your employees back in? How are you going to do temperature checks? And workplace safety for me is you have one shot to really get it right, because there are companies that are not doing things properly and are getting shamed in the press. And many of you have a brand and an organization name that's very important. It's been around for a very long time, and you don't want that getting out that you guys have not done the right thing. So health screening procedures. How are you going to clean the office? How often are you going to clean the office? I highly recommend that, depending on your size of your organization, you create a rapid response team. What is a rapid response team? That would be the go-to people. Should there be an illness or a suspected illness, they would be the ones that would get in gear and figure out what the next steps are, whether it's to isolate the individuals, do a little contact tracing within the organization, but those are the people who will be responsible for staying on top of the employee's health. PPE. You're also responsible for providing PPE throughout your company and any locations you may have. That's for your employees, your customers. You should have hand washing stations, sanitizing stations, masks. Depending on the need, the type of business you have will dictate the type of PPE you need. Now, very quickly, I have a lot of clients who have had difficulty getting the PPE they need. I now have a supplier that is willing to work with my customers, my referrals on PPE. And if you need any PPE, send me an email with PPE in the subject line, and we will make sure that you get connected and get the service and the PPE that you need. Physical distancing measures. How are you going to keep people 6 feet apart? Most offices were never built for 6-foot separation. Do you need to stagger your workday? What are you going to do about mealtime? How many people can go get a cup of coffee at the same time? Very critical things that you need to think about. You need to look at your business travel. Is it really necessary for somebody to go to a meeting in New York City or get on a plane? How are your customers or visitors going to be handled when they come in? What do you do when the UPS driver shows up, or the post office shows up, or just a visitor to your office? I was in a medical facility yesterday. They greeted me outside, taking a temperature check. I went inside. The next level was security, where they watched me sanitize my hand. I had a green ID bracelet that said I was cleared to be in that facility. And then you also need to keep in touch with OSHA requirements. The CDC just released expanded information on what you should be doing. So these are important things. Next slide, please. How do you bring your employees back? Well, you need to create an organized and very controlled approach. You really can't bring everybody back at once. You need to decide who's going to come back, who's a priority, who can continue to work from home, and you need to do it either by seniority or some other non-discriminatory factor. Very important. As I will reiterate throughout this discussion, there are a lot of legal pitfalls that you can encounter as you try to get back to business. You have to can they stay on a telecommuting basis? Should they remain on leave? Do you have increased measures in the workplace? And importantly, as you bring people back, you need to notify the state about the workers that you're returning, especially those that may have been on unemployment. Now, you're going to have employees who are unable or unwilling to return to work. You're going to hear people that will tell you that they're afraid of getting back to work. There are those that are in love with the unemployment numbers that they're getting, and then there are those who have legitimate fear. And this is where you have to be very sensitive and very thoughtful, and this has to be a discussion. As many of you are well aware, there is a healthcare crisis in this country, and a lot of it is being driven by anxiety. A lot of people are literally afraid to come out of their homes and go back to any semblance of normalcy. So you need to be very careful with that one and assess if it's a real health issue, which might move these people to a disability situation, or is it just they're just in love with the extra money they're getting on unemployment? It's all fair game. And then you have family obligations. Is somebody taking care of a sick child, family member due to COVID? Have they been quarantined? So these are all things that you have to take into account as you bring people back. Next slide, please. Employee benefits. My friend Chuck will take care of that. Compensation, another very important area. And many companies and organizations have made compensation adjustments to get through the crisis. There have been salary reductions, there have been hourly reductions. Those changes need to be addressed, whether they're going to be permanent or they're going to go back. You need to readdress those and to make sure that you are in compliance with all federal, state, and local laws, i.e., people who have been home, have they worked extra hours? Have they gotten compensated for overtime? You don't want to create a wage theft situation. Where pay increases missed because of the shutdown. And again, back to our people who may have been working part-time at an exempt basis now going back to, to non-exempt versus exempt, full to part-time. What do you do with bonuses, hazard pay? And it might be a time to look at a pay equity audit of your business or organization to make sure that there is equality between the genders on a pay basis. Next slide. Remote work, again, is it a short-term emergency or a new business strategy? Perhaps you may be creating a new business strategy where perhaps you would go with a hybrid, work at home a few days, work at the office a few days. That's a great way to stagger who's in the office at any time and to protect your infrastructure, because if you have cubicles that are normally spaced 3 feet apart, you're not going to have the same amount of space to accommodate the same number of employees. Probably most important here is communication. We highly recommend a clear and robust communication strategy. You need to have a communication strategy for your employees to let them know if there's any news that needs to be shared. And there are a number of ways to do that with Microsoft Teams, Slack are good tools, or just phone, email, whatever the case may be. You need to keep in touch with your customers, your vendors. Many have recommended that you have on your website that all of your employees were tested on a daily basis. And today, Thursday, May 21st, everybody checked out, everybody's healthy. It may be overkill, but this is where you separate yourself from other companies by allowing your customers to know that your employees are in fact well. You want your vendors to be well. You don't want any issues there. Again, sick and physical distancing policies, workplace training. You will have to train some people in the organization to be, for lack of a better term, a traffic cop. Who's going to enforce mask wearing? Who's going to enforce hand washing? Who's going to enforce the visitor policy when the UPS guy comes in and doesn't have, is not on, does not have a mask on, for example? Somebody needs to do that, and they need to be trained to be able to handle it appropriately, because across the country, you've all seen in the paper, people are getting shot, beat up, and broken through this. And again, a communication strategy ready to release. If there's a problem, get in front of it, get it out to the media, get it out to the community. Return to work timetables, safety, letting everybody know the safety precautions that you have in place. And by all means, support your workers and customers. Next slide. New hire paperwork. If you have furloughed people or laid off people, you will have to create new hire paperwork for those that were laid off. Furlough, they were just not working for a couple of days. And if they were laid off and you're bringing them back, even if it's a week or 2 weeks, you need to basically invoke all of your new hire practices and reports, I-9s, state notifications, etc. Next slide. Here's just a sampling of the policy changes that would need to be addressed in your employee handbook, and I'll just leave it at that. Next slide. And again, last but not least, I can't overemphasize business continuity planning. It's critical. And I'm not sure that anybody on this call is in a union environment, but if you are in a union environment, you need to look at those contracts again. So with that, I will say thank you, Jan. And if anybody needs anything, you'll get all my contact information.
Okay. Jan, you're on mute, but I'm assuming you're introducing me. I'm gonna keep going. But thanks, Mark, for everything. I'm gonna kind of talk a little bit more about the day-to-day operations that Mark was kind of give us a high level over. So if we can move to the next slide, please. So one of the things that we, as Paycor, as we're a payroll human capital management service, what we've seen is with a lot of our clients is people are putting up the federal and state required COVID-19 posters. So as you have regular posters in your office, these posters have to actually be given out, even if you have people working from home. So they can be sent out via snail mail. They can be posted up at on-site work locations, and they can also be sent out via email. We've even seen some organizations putting them on their website, kind of what Mark was talking about as well, and as part of their day-to-day, kind of letting the public know what's going on and that they're taking care of their individual people and also the external folks that they deal with. So if we can move on to the next slide, please. So one of the things, as Mark was kind of talking about, is having a checklist of everything that we need to go through. Some of these things, and we'll provide this to everyone after this webinar is over, but just little things that we want to make sure of. There's a couple of reasons why we want to do this. One, so we're compliant with the CARES Act and the FFCRA, making sure that we can get all the monies back that we were either given, granted, et cetera. Applying with all state laws. Chuck will talk a little bit in a minute more about the benefits that are going in there. Again, working with vendors, while we may be doing stuff that's very helpful for our people, if we're allowing folks into our facilities that are not taking care of them, are not doing the right thing, that could be a huge liability. I'll give a perfect example for that. My wife works for Suffolk County, and why the Suffolk County Police Department has had a biological attack plan in place. So they've had a very low COVID exposure rate as far as the police department. The rest of the county government didn't have that in place, and they actually don't even have a mask policy in place at this point. So, and they're getting all the PPE and from the state, and they don't have that stuff in place. So some of their folks may be looking for EFMLA or EPSLA because there's not a comfort level in the workplace. So again, that's something to talk about, and Mark can probably help out a lot more with that. Little things like facility cleaning. We all have sticky notes. Sometimes at the end of the day, even if we have shared workspace, could be something from as easy as a cash register is making sure they wipe it down at the end of the day and just putting a sticky note on it to notate that it's clean. Those little things are going to go a long way for this. And making sure that the social distancing policies, again, as Mark said, some of these offices, as we all know, were not designed to have us stay 6 feet away. But what we can do with that, also the mask policy and any other PPE that we have. And again, some little things like getting bracelets, or tokens, or different kind of color badging, just to make sure that people, as they move through, are maintaining a health standard. So we'll share this checklist with you guys, but if we can move on to the next slide, please. So in some of the stuff that we're looking for in employee health, and this is a big thing. So again, Mark has a resource if you need the thermometers and other PPE stuff. But we're looking at fevers that are over 100.4 degrees Fahrenheit, shortness of breath, difficulty breathing. So these are things to be on the watch. Why you may take someone's temperature right when they walk in the building. If you see someone having trouble breathing at some point during the day, don't have policies in place to recheck if you need to, make sure that you're applying with everything. Master planning for scheduling. If you have time clocks, even if you had backlogs at time clocks at shift breaks, differentiating those shifts. So having someone come in at 7:50, 7:55, 8 o'clock, 8:05, and making sure that it's properly accounted for in your payroll or time and attendance keeping system, because it's also going to apply to benefits packages, overtime, et cetera, and also for COBRA compliance potentially. And then on top of that, as Mark discussed, having interaction with your customers, right? Whether it be the customers, patients, the people that we serve in the community, making sure that we're doing the right things. Having a plastic barrier. These are very cheap. I mean, Home Depot and Lowe's are selling them. You can put up a protection barrier very quickly, very easily. So that's a very important piece of how you need to do that. And then posting on, again, they know the procedures. Make it, I think, if you posted a picture on a door 3 months ago, none of us would pay attention to it. But I think now everyone's paying attention to a front door as they walk into a building. So it's a very important piece. And if we move on to the next slide. So as Marc talked about, communication is a big piece right now. So even if your communication wasn't great before, now is the time to be completely turn a negative into an optimistic time point and communicate. And I would even venture to over communicate with your workforce, letting people know when and where to come back, what's going on, contacts for them to do, what to do if they don't feel good. Now's a big thing. If you don't feel good, we don't want you in the workplace, right? Because you're a potential risk to everyone, not just yourself anymore. So putting all this in communications and feel good stuff and letting them know what you're doing to help other people are very important as well. So we also have within this toolkit that we'll send out, we also have furlough letters and another return to work piece as well. So a mask policy letter, so which I believe is the next slide. We can go to that. Thank you. There we go. So the mask policy, well, one back, sorry, my bad. The mask policy is something very, very delicate here. And I would definitely talk to someone like Marc or your legal counsel on this, but, and you may have different mask policies for different people. For instance, you look at a supermarket, I'll use that for example. The people in the back that are maybe stocking shelves outside the customer range may have paper or cloth mask on, where your cashiers who are dealing with the public on a second basis may have N95s on or some other kind of respirator that can protect them. They also may have gloves on, etc. So having a mask policy in place, and it doesn't just have to be one policy per organization. It could be different policies per, if you have different sites. I know some of the clients we work with have office locations and they also have group homes, etc. There's going to be a different level of protection that you're going to want to have, or different level of PPE for those individuals. So we'll provide this letter to everyone as well, because I know it's a little hard to read on this. But at this point, I'll turn it over to Jan for Chuck.
So thank you so much, Brian. We had a couple of questions come in that I want to address before we move on to Chuck and Ilana. And so first is just a reminder that many nonprofits have HIPAA requirements. And as you're developing new policies and procedures and going virtually, to please remember, if you are a HIPAA agency, to just make sure that those systems are in place. The questions that we got, a number of questions, and I believe these are for Marc, and it may be necessary for organizations to also contact their legal experts as well. But they fall into, if you have a vulnerable employee, age, or they have compromised health, and they do not wish to come back to work, can you make them do so? And along those lines, if you have an employee who cannot come back to work because of childcare, because their childcare facilities are not open, or there's no summer camp, or other things, what do you do about that in bringing back that employee?
Okay, there's two questions there. Certainly the high-risk individuals, if they can get a letter from a doctor that says they're high risk and should not be in the workplace, then you have to make accommodations for them. That could be telecommuting or some other arrangements, because your ultimate obligation is to provide a safe workplace. If you can't provide that safety for them, then you probably ought to continue working with them on a telecommuting basis. That's number one. Number two, with regard to childcare, the Family First Act, the FFCRA, stipulated that if you were entitled to take leave if you were home taking care of a child whose school was closed due to COVID-19. So schools are closed for now. I'm not sure, and they say childcare. I'm not clear, and it would be a question for an attorney, and I will certainly find out and get back. I'm not sure that camp is it is considered childcare, but whereas school is mandatory, there's nothing that says camp is mandatory. So there's a bunch of gray there that I'm not really sure. Certainly they're entitled to the leave at a minimum through the end of the school year. What would be the end of the school year? I don't know if camp really becomes a mandatory category of childcare. I would have to get back to you on that one.
Thank you. Just a couple of more questions on this, about 3 more, and then we're going to go over to Chuck and Ilana. So yes, this presentation will be made available, both a recording and the PowerPoint, and you will have all the information and contact information from our presenters and the templates and everything else that you may need. So that was just a few questions, 3 or 4. And thank you to the people on this presentation for being willing to communicate with people who do have questions. And just a reminder, they can't, answer extensive questions, but they are available for phone calls. And then a question came through, and I think Brian can answer this one. Because some people are asymptomatic, is taking staff temperatures really effective and necessary?
Yeah, so one of the things that we're talking about with our checklist is having a master schedule. As local governments are hiring these tracers, I believe they're called, to kind of find out historically or do some auditing of where everyone is coming from that may be infected. Just because someone isn't, it's still important that you have that information, and also so having the checklist that you check them, because one day they may not have it, one day they may, and it allows the tracing to find out who is infected, because there may be legal requirements that we have to reach out to people that they touched. It's also just not the temperature, because you may have one symptom and not the other. So that's why we also mentioned the breathing app. If someone's having trouble breathing, or they're having a shortness of breath, those may be other things you want to look at as well. So it's not just, scanning the forehead with the thermometer and then moving on. It's taking a quick look at some of the other diagnostics that may be there as well.
Okay, so I think we do have some more questions, but I'm going to turn this over to Chuck and Ilana. And if the questions are not answered today in this presentation, we will make sure that they are answered as a follow-up. So very happy to welcome Chuck and Ilana, and take it away.
Thank you. Good morning. Thank you, Jan, and thank you, Suzanne, for working so hard to set this up and for all you're doing for the nonprofit community during this crisis. It's been amazing, and the resources that you've put out there have been so helpful to so many nonprofits. As health insurance and employee benefit brokers, our day-to-day typically is really advocating for our customers and running interference with the insurance companies. And a lot of times that means when an insurance company is denying a pre-authorization for a procedure or for a specialty medication or for an advanced test, like an advanced radiology, we get in the trenches, we get in the mix and try to help our customers. Well, the good news is that during this crisis, insurance companies have exhibited a lot more flexibility, a lot more willingness to work with their customers, our customers, et cetera, to really help them through this. They've been offering from really the beginning testing without cost, some treatment without cost, not all, but some treatment without cost. And that's really morphed over time into some of the government requirements that insurance companies allow forbearance on premiums, not forgiveness of premiums, but forbearance, meaning that for COVID-related issues, those premiums could be deferred. But then it becomes potentially a bigger problem because if you're building up 2 months of premiums and having to pay 3 months at one time, it might not even be possible, but that is out there. Telehealth, which was a thing before the crisis, has now become a huge thing, and many times without cost, depending upon the provider that you're using, the insurance carrier that you're using, you can access physicians, physician assistants, virtually without cost. So that's really become a trend. One thing that I want all of our nonprofits to know and to think about with respect to budgeting for next year, and I know many of you are possibly even starting on your budgetary process, or you've already gotten into that for 2020, 2021, depending upon your fiscal year. Right now, we're hearing about insurance companies actually giving some money back because we haven't been able to go for elective procedures, right? So they built those elective procedures into their cost model, and they're actually potentially, in many cases, giving money back to us. Well, that's a double-edged sword, right? If we're putting off checkups, if we're putting off, and now there are a lot of conversation about children, parents putting off vaccinations for children, what the manifestations of putting those things off can be over time, and the kind of costs that we may be looking at down the road for having put those off. So overall, even though experience, especially if you're self-funded, might be very good right now, we're looking at potentially a 10% increase over the typical medical trend for next year. Typical medical trend in any given year is usually about 12% to 15%, 10% above that. We're talking about 20 to 25% increases. I'm hopeful that doesn't happen, but I think nonprofits should be well aware that that could be an issue. Just to finish up before I introduce my partner, Ilana Arbeit, one other thing, there's been a lot of discussion from Marc, great information, from Brian, great information. That's all that spurs are questions about the legal liabilities that we're having. One of the things that we've been able to furnish to our customers during this crisis, and that will be on an ongoing basis, is an hour of legal consultation per month, a free hour of legal consultation per month with an employment law firm, a national employment law firm called Ford Harrison. So that's available to all our customers. We also have another facility for a $400 annual cost for unlimited legal consultation with a law firm by phone or by email. So keep those in mind. These are things, again, you'll be needing a lot of legal help to prevent you from incurring those liabilities. So without further ado, Ilana Arbeit, my partner and incoming president of the New York Association of Health Underwriters, to give you a little bit more about what's going on in the insurance market today.
Thank you, Chuck. I didn't realize that my term was coming up. In literally like 2 months, I'm about to become the president. So that's happening.
Timing is everything.
So thank you everybody for being here. So I guess we're just going to kind of go through some of the topics that are important when you're considering things with relation to your benefits. So the first is, did you furlough your employees or did you lay off your employees? So if you furloughed your employees, they might still be on the plan, but I'm going to come back to that one in a minute. If you laid off your employees, then you need to add them back on. So you might need new enrollment forms, or if you're using an online benefits administration system, like a lot of our clients are, you're going to need to set up like a special enrollment period. And I know Marc touched on this, but again, like what other documents do you need? Do you need a new I-9? Do you need to fix Section 3? There's all sorts of different items that need to be considered. Just going back to the furloughed employees, this just came up from one of our carrier partners, and they're sending this around. If you're a group and you're kind of on that the cusp of the 100 full-time equivalent mark. So in New York State, there's 2 categories. In New York State, you're either a small group or a large group. If you're under 100 full-time equivalents, you're considered a small group and you get community rates. If you're over 100 full-time equivalents, then you're getting large group rates, and there's a different rating mechanism. Well, if you're somebody who's on the cusp and you furloughed or laid people off, next year, the carrier is going to send you that survey that many of you get every year, and it's going to say, what was your full-time equivalent count for 2020? And if you fall under that mark, you might be pushed into the small group market, which for many groups is not beneficial. So I'm just putting this out there. If anybody here is in that category, reach out to us after, and I'll give you a template of a letter that can go right to the Department of Financial Services to help, because it's in all of our best interest downstate to have them not consider full-time equivalent count from this time period for next year. So I'm just putting that out there. That was a new thing that just came up. Next slide, please. So the next item is putting your employees back on benefits. So if they were terminated, well, now they might be eligible for benefits again. But the question is, how does your carrier, how does your contract handle rehires? Very often on your master application that if you've been with the same carrier for a long time, you may not even remember what you checked off, but they ask you, do you want the waiting period waived for rehires? And if so, if they're rehired, within how long? So it's important that you know when everybody is going to be eligible again to join your policy, or whether a new waiting period is required. I can tell you that because the carriers are being so lenient right now, they're really trying to work with our clients, we find. If you don't waive waiting periods currently for rehires and you would like them to, they'll help you make that change. But everything that I'm telling you, everything that I'm saying, you need to make sure that your plan documents, your summary plan descriptions, your ERISA wrap documents, all of those things need to be updated as you're updating your policies. Next slide, please. Employee contributions. So this is a big one. If you furloughed your employees, you continued to pay their premiums for them likely, and you allowed them to stay on the plan. If you're not a company that pays 100% of your employees' benefits, they may owe you money. Were you collecting their portion while they were out? And if they were you paying it to the carriers? If you weren't taking money for them while they were out, what is your plan to recapture it? So these are really important things that you need to consider. And also, is your health plan paid to date? I know that a lot of carriers were very generous and allowing, and actually it's state law, and I know New York and New Jersey both passed state laws that allowed for extended grace periods for plan premiums. So, you know, I know in New York, all of your premiums are due by the end of this month. So what is your plan to pay back if you haven't been paying your plan premiums? Next slide, please. And again, here we go. So what's the plan? Did you defer? And if you were collecting employee premiums while you were deferring, there's a whole other set of issues that you need to consider. But hopefully everybody is paid to date and has a plan to repay. Next slide, please. So just in general, I know Chuck touched on this. Does your plan include telehealth? There were some carriers that kind of added it in there as a freebie, and some of them are going to continue to offer it, but it's not going to be free anymore. So your employees may be responsible for a copay or something like that. So you want to make sure that you still have telehealth, and if your plan doesn't include it, can you get it elsewhere? Because telehealth is becoming more and more relevant. Just people are seeing how quickly different diseases can spread. So the idea of being able to see a doctor from your home and not having to sit in a waiting room with other sick people is becoming more attractive. So if you don't have telehealth, can you get it? Do you know where to get it from? A lot of carriers allowed mid-year plan changes. So did that impact your renewal date? Did it impact your plan year? And again, make sure that any changes to your medical plans are included in your plan documents, and that you communicate these to your employees. This is super important when it comes to just the Department of Labor. You don't want to get stuck having a policy that doesn't match up with what the documents say. Next slide. Flexible spending accounts. So there are all sorts of different rules, and our government likes to change the rules on us, often not always in great ways, but this is actually a good one in my opinion. So first of all, employers can now allow their employees to make mid-year plan changes on their flexible spending account. So you know, many people might have had out-of-pocket expenses due to this event that they were not considering when they made their elections, let's say in the beginning of the year. So they would be allowed to elect more at this point. The other good thing is that over-the-counter medical products are now allowed expenses. It used to be, you used to have to get a prescription from a doctor for Tylenol if you wanted to use your flexible spending money for it. Now you can just buy the Tylenol. Something else about this, there's so much that has come out that I just, I don't even have slides for it yet, and I'm gonna create slides before we send this out to you because this is so important. The next thing is with regards to the Section 125 things, COBRA and HIPAA events have now been extended. So there's a whole new rule where I think it's starting from the beginning of what they call the catastrophe period or something to that extent. So it's going back to March. Anybody who's eligible for COBRA or had a baby or got married, the amount of time that they have to elect benefits, pay their premiums, all sorts of things has now been extended. And it's been extended till the end of this catastrophic period, which, as we know, there's no end date yet. So this is an indefinite change. This is really, really a tough one because, first of all, most of the carriers are not set up to make these changes. So if I have a baby in March and then this is still going on in June and I come back to my carrier and say, oh, I need to add my baby back to March. First of all, most of the carrier systems are not really set up to go back that far without having to go through a whole exception process, number one. Number two, now your employer has to recapture all that money from you if there's a different scale of contributions for singles, for families, for whatever. There's all sorts of complications. With regard to COBRA, again, same issue. Somebody can wait 6 months, make an election and need to be added back onto the plan, but then they also owe 6 months of premium. So while it's a good thing, it's also very, very tough, and it's going to make things a little bit complicated for employers, for brokers, and for third-party administrators. So I just wanted everybody to be aware that this is a moving target, and it's just something that you should have in the back of your head if you have an employee who had a qualifying event or you have somebody who's on COBRA. And speaking of COBRA, this is another thing that's going on that everybody should be aware of. On May 15th, so that was last Friday, the House passed a bill that includes all sorts of things. I think it's called the HEROES Act. It includes a lot of things, but the thing that I want to just touch on is that it includes 100% subsidy for COBRA premiums. So some of you might have been around as long as we have, but back in 2009, there was a similar thing that was passed as a result of the market crash and all that, where the subsidy, though, only covered 65%. This is actually suggesting that it cover 100% of COBRA premiums for people who have been laid off or furloughed as a result of COVID. So again, I mean, it can be a very, very good thing. We don't want people to walk around uninsured and not get the coverage that they need, especially during this tough time. So there's so many things going on. I know the Section 125 plans also, they were stuck at $2,500 maximum contribution for years and years and years. Now it's going to start to increase with inflation. So I could talk about this all day. I'm not going to, don't worry, but there's a lot going on. So it's important that you have resources that you can rely on that will give you the most up-to-date information. And I think, do I have one more slide?
Yes.
There you go. Okay. So again, this is tying back to Marc and to some of the things that he was talking about. You might need to revisit your handbook now. Now is the time. You have all of these new policies that need to be included, and they all need to be considered, and now is the time to make the change when we're kind of starting with a clean slate. And again, really important that you know who to call with these questions and that you have a reliable source for that. That is it for me.
Okay. So we have until 11:15 for this webinar. That's what we planned. Just a few slides that are really important to the nonprofit sector. Please remember everybody to take the census and to work with your clients and constituents in your mailings to make sure that they are doing this. Next slide. And vote. The whole procedures around voting have been very confusing. We have a summary sheet which we will send out with this presentation as well. Next slide, please. We will have a whole bunch of resources that we will send out to you, and even more than what's on this on these slides at this time, but they will be comprehensive. Next slide. More resources. Next slide. Even more resources. Before we go to the questions, I want to remind everybody you will have contact information for Marc. Next slide. For Brian. Next slide. For Chuck and Ilana. Next slide, please. Also, Joe Pizzamente and C Clean. They are a very well-known corporate nonprofit cleaning service. They have all sorts of products and tips out there, and we thank them, as we do our speakers, for supporting nonprofit Westchester and our agencies. Next slide. My contact information. Next slide. Questions. So I'm going to get back to the questions. I just want to say we understand childcare is a huge issue, whether it's camp or, you know, childcare during the school year. We are working with our public policy committee, and Kathy Hallis from the Child Care Council, who's an incredible advocate, is working with me. So we are going to try to address this, you know, as fully as possible from the advocacy perspective. A few questions about where do nonprofits fall in these phases? Nonprofits represent a whole bunch of different organizations. So where one nonprofit may fall in phase 1, 2, 3, or 4, another may not. I recommend you going to your oversight agencies and asking those people that you work with. I also do want to get back to the employee handbook, because your employee handbook is at this point one of your best forms of communication internally, and is really, really important. So I want to bring that back to Marc. If there are any recommendations or suggestions that you have, it seems like a very daunting thing to start, as is like a disaster plan. And I know that our friends at Nonprofit New York have a great template, and I can work with our nonprofits on that. But the employee handbook, which not everybody has, where do you have any more advice on that particular issue?
Yeah, well, we make the employee handbook process very pain-free. We basically, once we start working with a client on it, it's a meeting and a questionnaire, and we go through all of the details. Certainly handbooks need to have federal, state, and local laws in it. And then there's the customized portion for the individual organization or business. And we go through that, we make it really painless. And at the end of the day, you get a legally compliant handbook that has been reviewed by outside employment law counsel. And, you know, like I said, we can get that done. The other thing I'd like to offer that we're doing, and certainly for anybody on this call, I'd love to offer them, anybody that signs up from this call for a handbook, we will maintain it and keep it current throughout the end of the year. And that's normally probably about a $750 savings. So you'll get the handbook and it will be compliant and current through 12/31 of this year.
Okay, so we have some other, thank you so much. We have some other questions coming in. Specifically, where do churches fall in the phase protocol? I don't know. Those are questions. I would go onto the state website, and if you don't get any clarity from that, circle back to me, contact me. I'm going to try to get more clarity on the phases. It's just not out there right now. But what I do know that happened yesterday is that religious institutions can hold services for 10 or fewer people. That's in person. And we'll try to get more information. I would just like for our presenters to know we have a comment that this has been an absolutely fantastic session. Thank you. In addition to getting the deck, might we get a copy of the recording? And that answer is yes. We have another question here. I am a nonprofit that is not in a healthcare environment. Who is qualified to administer the temperature taking, and what are best practices for recording the temperatures?
Yeah, I'll take that one, Jan. So we recommend third-party personnel to come in, so you can, whether it be a nurse, a nurse's assistant, something like that, or someone that's trained in it. So depending on the thermometers that you buy, there may be a training course online that goes with it. As far as the recording, you should have, whether it's an HRS system, a payroll system, or just a standard checklist that you're kind of doing in Excel, you could do it with. And that would be sufficient. Again, this is HIPAA compliant as well, so you want to make sure that whatever results you're getting are kept private for that individual employee as well. So I hope that answers that question.
Yeah.
And Jan, that was also when we talked about training somebody to be the, for lack of a better term, the enforcer, or that person. You have that one person who's trained. Most of these thermometers, the ones they're using, are very simplistic. And if it's somebody who's just trained how to appropriately do it, how to appropriately keep the information confidential, it could be probably most likely somebody internally as well.
Yeah, and this brings to light unfunded mandates. Everything we do and everything we add to what we're already providing is an expense, and we are advocating around that too with the state. How are we going to address these training costs, and how are we going to address the need for even more supplies. So we have a question: is the temperature taking required or suggested?
So fun answer to this, it's suggested, but it can be required. So it's not a mandate that the state's saying you have to do it, I believe, Mark. And Mark can correct me if I'm wrong there. But if you do it, we do recommend that it is required for all employees. So you're not, eliminating anyone from that.
As of right now, it is not required in New York State. However, as I had said earlier, you want to do this right. And if you do a little bit of overkill on it, it's to your benefit, because the last thing you want to have happen is your organization become a hotspot, both from an operational perspective, from an outside press perspective. So going above and beyond, even though it may be annoying, is my recommendation. If there's too much at risk, to not do it and do it well.
Thank you. We have a suggestion that MPW make a shared purchase of thermometers so members can get a lower price. We will certainly look into that. Another question, I just want to be cognizant of time. We have about...
Hey, Jan, I will talk to my PPE vendor and see if I can maybe, if you could tell them, if we can get some, maybe I can work on something on that item specifically.
Great, thank you. Do we pay employees who cannot come in nor work from home, i.e. healthcare aides, teachers in private childcare? So, I guess the question is, there are some people who do not have the option of working remotely. Those seem like those are...
They could fall under the EFMLA, the EPSLA as well. So it would kind of be a more of a one-off conversation piece there.
Yeah. And they could also be already in the category, the healthcare aides, of essential workers and may have to go to work. So Yeah, that is a one-off question, and I'm not exactly sure what's being asked. What if the staff is direct care essential and telecommunications is not an option? Um, so what if specifically they are required to go to work because they are essential? There is work for them to do and they don't feel comfortable going.
First of all, the mandate is if there is a job for you, you must go back to work or you will be effectively resigning unless you fall into a protected category of, that we talked about. In terms of communication, everybody knows their own organization best, and you have to, if you don't have a communication protocol in place now, you really need to develop one. And you know your business best, so you have to figure out a way to have ongoing communication with everybody, whether it's a text, a fax, you know, a carrier pigeon. You've got to come up with a program.
Yeah. I do want to remind everyone that Brian brought up something earlier about the required posters that you usually post in your office. You are required to make your employees see these posters. So whether it's on your website, whether it's emailing them to all your employees, please do that because you don't want to get caught being non-compliant of something that's, you know, easy to comply with. So I have a very long question here for Marc, but it's basically about moving the employee to disability. I guess the employee that does in fact have a level of anxiety that will cause a disability.
Well, let me drag Chuck and Ilana into this. I mean, if there is a bona fide case and certified by a physician that the person cannot come back to work, let's say using anxiety, then I guess it would have to go to the insurance carrier, would it not, Chuck?
Oh, you're talking about their short-term disability, potentially, yeah, if they're considered disabled.
Yeah.
Yeah, and I think you said the key word here, Marc, is that they would have to have something from a doctor stating, in fact, this is something that they're being afflicted with at this time. Marc, can you take a look at that question? It's quite extensive. I don't.
Maybe.
Yeah.
It's so in depth that it might demand a direct conversation, I think, with Marc.
Yeah, I think at some other point. So we will get that question answered. I just want to check. We have another question. As it pertains to reopening, if you're phase 4 organization, will your employees, administrative staff be allowed to come back to the workplace during phase 2 to prepare the facility for eventual reopening? I think that would fall on me, and I think that legally the answer is no. You're not allowed back into your workplaces until you're not allowed to reopen until your phase has started. I will double check on that, but I'm pretty certain from reading all the rules that as part of trying to contain the virus, you can't go back to the workplace because there's no way of monitoring that workplace officially. And if you have to inform the state of when your employees are going back to work, that would qualify as going back to work and to the workplace. So I wouldn't do that, but I will double check on that as well at this point. So I'm really glad that we extended this until 11:15. Again, I am really, really grateful for the subject matter experts that have joined us here today. Brian Auerbach from Paycor, Marc Roberts from my HR department, Ilana Arbeit, and Chuck Newman from Charles Newman Company. We will send out to those who signed up for this all the contact information, the links, and everything else that you may need. And we are all accessible to you. So we do look forward to hearing from you. I hope that everybody, that it's a nice Memorial Day weekend weather-wise, and that we can all get outside a little and look forward to reopening our lives and our businesses. And thank you. Thank you all for the work you do. We have some really special people on this webinar, and that is the nonprofit sector, which we know has really kept our community going during this crisis, along with our healthcare workers and all the other people that are out there on the front.
I'd like to thank you, Jan, and again, Suzanne, for putting this together, and for Marc and Brian and Ilana participating. I know Brian and Paycor, they're doing a lot with nonprofits and offering free payroll till the end of the year, things like that. So everyone's trying to do their part to really help the nonprofit community who's of the panelists here today.
And again, just real quick, if you are having trouble getting the PPE you need, send me an email, PPE in the subject line, and we'll make sure you get connected.
Great.
Really great, Marc.
Okay. Have a good day, everyone.
Thanks, everyone.
Thank
Thanks,
you.
everyone.